Pelvic floor dysfunction is one of the most common yet most misunderstood issues in our society today. Not only is it somewhat taboo to be talking about the pelvic floor, but the understanding of what the pelvic floor is, the role it plays in health and function, is not prevalent either. On today's episode of the Exercises Health Podcast, we sit down with Dr. Stefanie McMillin, a physical therapist specializing in pelvic floor therapy, to discuss what the pelvic floor is, what issues typically stem from dysfunction within the pelvic floor, and what you can do to help make sure that your pelvic floor continues to function well. We are going to cue the intro song, and then we're going to dive right into this conversation. Welcome to the Exercise is Health podcast, where we're talking about exercise, health, and the interconnectedness of the two. We are your hosts, Charlie
and Julie,
and we will be coming to you every single week from our studio, Muscle Activation Schaumburg. Hey, welcome back, everybody, to the Exercise is Health podcast. We are your hosts, Charlie
and Julie,
and we're coming to you from our studio, Muscle Activation Schaumburg, here in Schaumburg, Illinois. Now, at Muscle Activation Schaumburg, we believe your health is your most valuable asset, and the single best thing that you can do to both boost and protect this asset is exercise. Specifically, exercise is geared towards building the health and function of your muscles. But we know that exercise is not the only piece of the puzzle, and that is why we have a phenomenal guest for you today, none other than Dr. Stefanie McMillin. Stefanie's passion for women's health started at an early age in the form of studying about pregnancy and childbirth. This passion is what led her to specialize in urogynecology after receiving a Doctor of Physical Therapy degree from Midwestern University in 2014. Following graduation, she immersed herself in all things women's health. After countless hours of continuing education courses and extensive training through the Barrel Institute, she began utilizing visceral manipulation to help restore health and functionality within the female pelvis and abdominal viscera. After assisting with the birth of her nephew in 2017, she was propelled to become a certified doula. Through her work as a women's health physical therapist and visceral manipulation practitioner, her deep understanding of anatomy and physiology helps tremendously, both in her treatment room and in the delivery room. She has spent years treating postpartum conditions and has found that far too often women are not getting the care that they need in the fourth trimester. It is her mission to bridge this gap by providing education and postpartum intervention alongside her work as a doula. She feels strongly that the aches and pains, both emotionally and physically, that come before, during, and after pregnancy can be eased and prevented with gentle manual therapy, education, and guidance. Stefanie has met and worked with hundreds of women over the years and has become a vocal advocate for birth and women's health. She founded Full Circle Birth and Pelvic Health after realizing there was a better way to care for women. She wanted to be able to spend more time with her patients, provide more holistic and conservative therapy options, and tailor more personalized plans of care. In her free time, Stefanie enjoys reading, playing volleyball, exploring other parts of the world, and spending time with her nephew. Stefanie, thank you so much for joining us, and welcome to our show.
Thank you. Thank you guys for having me.
You bet. It's our pleasure. So tell us more about your background and how you got into physical therapy, and then we'll kind of go from there into your specialties.
Awesome. So I have my Doctor of Physical Therapy with a specialty in pelvic health. And then I'm also a certified birth doula. So I knew I wanted to specialize in women's health and in pelvic health, which is what brought me to grad school in the first place, despite literally every single one of my professors discouraging that and telling me that I really needed to focus on orthopedics and hone my skill set before specializing. So I'm glad that I did not listen to that advice and I jumped right in because this is what I've always wanted to do. So I've been in the world of pelvic health and in this specialty since I got my license for the last 7 years now. And then about 4 years ago, I decided to kind of continue my education and get my certification to be a birth doula as well. I really feel like doula work and pelvic PT is truly the perfect marriage of two specialties. Who better to support you in your birth experience than someone with very intimate knowledge of that area? So it's just wonderful. I feel like I have the best job in the world and I absolutely love what I do.
It's amazing. So what do you do today? Like, what does your work look like? And what are you doing on the day-to-day in terms of serving people with pelvises?
Yeah. I've been pulled to birth work since probably my early teens. I've been studying about pregnancy and childbirth since probably the age of 14. So I've always just, all birth workers will tell you birth work is a calling. And there's just really no other way to explain it. You just get pulled into this work. But what led me to finally pursue my certification in doula work was what I was seeing in the clinic day after day, which was women would show up in my office in various stages of postpartum, and they'd sit down in my chair and we'd be doing the evaluation. And I'd be like, all right, Jamie, what's bringing you in to see me? And these women just would look at me, their eyes would well up in tears, and they would start crying and grab for the tissue box and explain to me their birth stories, which were filled with trauma and all sorts of things from being induced early and laboring for 30 plus hours before having a cesarean to, having their perineum cut without consent to pushing for 5 hours and having that experience just be so traumatic for them. And so I couldn't understand what was happening, right? Because I see so many women for prenatal care, and then they would go off and have their babies, and then they'd come back in postpartum with just all of this trauma and all of these horror stories, and their physical bodies were not well. And I think that a lot of the physical things that we experience after having a baby contributes to a lot of the mental postpartum depression, postpartum anxieties, and women are just not getting the care that they need in the fourth trimester. So, this, Julie, you're used to seeing your provider at the end of your pregnancy. You're being seen like every week. And then you have your baby and do this gigantic physical, emotional, mental, spiritual event. And they're like, see ya in 6 weeks, like, good luck with everything. Like, you'll be fine. And you're like, hey, I'm not fine. Like, what's going on here? So I really wanted and was prompted to start my own practice so that there's a better way to care for women than what you see and what you hear about all the time. And I really wanted to be able to spend more time with my clients. I wanted to be able to provide the education that I feel is lacking, and then also just bridge that gap in postpartum care where women are just completely getting discarded after their babies, after they have their babies, and they're really just not getting the care or the support that they need. So I started my own practice in January and have been rocking and rolling ever since. And it's just been amazing. So I'm very happy with it.
Well, kudos to you for that. I mean, being small business owners ourselves, we can definitely empathize with the day in and day out, roller coaster that can be running and owning a small business. So on top of everything else you have going on, congratulations on that. And yeah, absolutely. So when your clients come to see you, is your predominant client demographic, is that women postpartum? Or what's kind of the predominant aspect of your business or your practice?
Yes. So my passion is in pregnancy and childbirth and helping women to navigate that whole time frame. So now it's really lovely because I get to see women for prenatal care while they're pregnant. I even will see clients who are struggling, with fertility and conception. And so I get to be on this journey with my clients from the very beginning through their pregnancy, through their birth, and then follow up with postpartum care. I'll get women through various stages of conception and fertility, but I also treat all pelvic health dysfunctions. So any men, women, and children who suffer from pelvic floor dysfunction, which can look like many different things, I treat it all.
So as we dive into this, I think the pelvic floor, at least to me, until I started having babies, was like this complete mystery area. And I gotta tell you, I know a lot about the body from what we do, and it's not an area that I think a lot of us think of as something that could be treated or something I could have a problem with until there's a problem there. So can you give us the 1,000-foot view of what is the pelvic floor? Tell us a little bit about what this place is.
Yes, I think starting with kind of pelvic floor 101, I think is super important. And it's always been just wild to me that this is a muscle group just like any other muscle group in the body, which means in order to be functional, it has to do the same things that any other muscle group in our body have to do. It has to contract, it has to relax, it has to be able to lengthen functionally for it to do all of its roles and functions in our body and to do it well. So the pelvic floor muscles, what they are is this kind of bowl of musculature that sits at the bottom of the bony pelvis. They sling from the pubic bone to the tailbone, and then from side to side from one sit bone to another. So it truly makes this hammock and bowl of muscles at the bottom of the pelvis. And within that muscle group, there are 3 different layers of muscles. So it's a really complex and intricate area. From superficial at the opening to kind of deep in the body, there's 3 different layers of muscles. And all of those layers, again, have different roles and functions in our body. And so those muscles are deeply connected to the core. And again, I think a lot of pelvic floor dysfunction is missed, especially in the orthopedic world. These muscles attach to our pelvis, to our spine. They're deeply connected to our core. Pelvic floor dysfunction can present as hip pain. It can present as low back pain. It can present as sacral and glute and tailbone pain, hip flexor dysfunction, pain, decreased range of motion. I mean, there's a lot going on there. And in the orthopedic world, we just act like the pelvis doesn't exist. If someone comes in with those pain complaints, we treat them orthopedically, just focusing in on the hip or the knee or whatever it is that they're complaining of. And we act like the pelvic floor just has no involvement whatsoever. So I would love to see orthopedic providers adding in a pelvic floor screen just to their regular intake forms to capture these people, because often it goes undiagnosed and people just think that they failed physical therapy or that they have these things that can't be helped. And that's just simply not true.
So how would somebody know? Because like you're saying, it can present as so many different symptoms. What might be a trigger that somebody says, okay, yeah, maybe this is a pelvic floor thing that I should have a pelvic floor therapist or specialist kind of explore deeper?
Yes. So kind of going back to just some education about the pelvic floor, those muscles, we talk about the 5 functions of those muscles as the 5 S's. They have a supportive function, meaning they support our pelvic organs, our rectum, uterus, and bladder. They have a stability function where they provide stability to our pelvic bones, which should be inherently stable. They shouldn't be able to have a ton of motion in order for us to function. Those muscles also have a sexual role. They bring blood into the genitals. They allow us to achieve orgasm. So orgasm is really just a rapid contraction of those muscles. And then they also act as a sump pump, meaning in your inguinal canals, we have a lot of lymph nodes. And so those muscles act to pump fluids in and out of that area. And lastly, the last of the 5 S's, they have a sphincteric function, meaning they help us start and stop the flow. So you can have dysfunction in any one of those systems, from difficulty conceiving to urinary symptoms, like where you can't empty your bladder, or you have burning every time you urinate, or you feel like you get chronic UTIs, or you just leak urine with coughing, sneezing, and exercising. Bowel issues, same kind of thing. You can have fecal incontinence, constipation, just chronic abdominal pain, difficulty with your menstrual cycles, irregularity, tons of pain. All of that we're kind of made to believe that our periods should be painful. Everyone has pain with their period and that's just normal, but that's simply not true. You can have scar tissue issues if you tear during birth, if you have a cesarean. Those adhesions cause a lot of pelvic floor dysfunction. Pregnancy and postpartum, there's a slew of things, from pelvic organ prolapse, where you feel just heaviness and pressure in the pelvic area, like something's falling out or something's heavy down there. You may even see something bulging. All of those are signs you need to see a pelvic floor therapist. Diastasis recti is a big one in pregnancy and postpartum. Any kind of sexual dysfunction, pain with sex, inability to orgasm. Any one of those things is a cue that you've got some pelvic floor dysfunction going on. And then there's a lot of just pelvic pain conditions like endometriosis, vulvodynia that exist out there that people suffer from. A lot of men have chronic pelvic pain, testicular pain, scrotal pain, tip of the penis pain. They have pelvic floors too. So they experience urinary issues, bowel issues, the same things we do. We just have to look at them a little bit differently based on the anatomy. Any one of those things could bring a person in to see a pelvic therapist.
Sure. As you're describing these things are things that aren't commonly talked about at all. So I can see how so many people could be struggling with, one or a handful of these problems, and it's just never talked about. They might feel like, I'm thinking about it. I'm thinking, man, if I had one of those, maybe I would think, I don't know, am I weird? Is this normal? So what is it like when someone comes in to see a pelvic floor therapist?
Yeah, these issues are really private and personal and intimate and very debilitating to people's quality of lives. And so it's super important. And I take my job very seriously and feel very honored to be able to help people to heal these aspects because of the effect that it has on people's quality of life. So when clients come in and when I see people in the clinic, kind of that first visit, the first thing we're doing is having a discussion. I'm asking what's bringing you in to see me. We're discussing past medical history, bowel symptoms, bladder symptoms, pain, sexual function, all of those roles and functions of the pelvic floor. We're going into great detail about those things. I read a study a long time ago where over 39 million women report having some form of pelvic floor dysfunction. But, those are only the ones who feel comfortable enough reporting that. Those numbers are widely underreported. How many women, how many men don't feel comfortable saying that they have an issue down there in such a private space? So they just deal with it or don't report it. Or you're made to feel like, well, especially with moms and new moms, well, you just had a baby. What do you expect? Even your OBGYNs will literally tell you, you'll be in their office complaining of one of these issues. And they'll say, you probably won't feel normal for like a year of postpartum. That's just wear a pad. That'll go away. That'll get better. Those things don't just go away and they don't just get better with time. They often get worse over time if left untreated. So when people come in, the first thing we're doing, like I said, is having a big discussion. I think it's important for people to tell their story because often when it comes to pelvic floor dysfunction, people have seen a variety of doctors. They've tried a variety of therapy techniques. They've kind of been through the ringer of people who are like, this is normal. Maybe it's all in your head. Are you stressed out? Like those kinds of questions. And so I think it's really, really important that people are able to share their story, share what's going on. And then we go right in from there to an education component, validating their symptoms and explaining why they're feeling that way and how it's totally warranted based on the anatomy and the things that they've been through in their medical history. And right then and there, I feel like I can see a change in people instantly. It's like, that's where the healing starts, is right from that square one. They're like, oh, she understands what I'm talking about. She's heard of this before. Maybe I'm not crazy and maybe I can actually be helped. And so that's one of my just favorite moments whenever I meet new people and evaluate them, is when you kind of give them that validation and you listen to them and educate them on the body. They're just blown away by that. And then, of course, we do an exam to really see what exactly might be contributing to this dysfunction. And from there, we discuss a plan of care and what that might look like how often I think you need to be seen, what treatment techniques that we'll be doing together. And then there may or may not be kind of a home exercise component in that first visit. So that's what an initial visit with a PT looks like. It's never as scary as people think it's going to be. It's never as weird as people think it's going to be. It actually is very healing and becomes very comfortable. And you finally feel seen and heard for the first time in a long time. So it's good stuff,
That's great. You explained something in a way that I really liked, where it's like, hey, there's muscles that make up your pelvic floor. And kind of your job is to make sure that they're functioning the way the muscles should function. They contract when they should contract and relax when they should relax, and they lengthen when they need to lengthen. It sounds so much like what we talk about on our podcast when we talk about our MAT podcast. But the difference is that we're talking about muscles that people see. Like, hey, when you're doing a bicep curl, can you connect mentally to the bicep? Can you sense what's happening in your bicep and what's happening at that joint? Or if we're talking about quadriceps, these are muscles that we think about all the time. We can visually see them in the mirror. Pelvic floor muscles are not like that. So I'm curious, how do you help people with this?
So one of the first things I explain to people when we're talking about the pelvic floor and contracting, relaxing, and lengthening, I kind of just try to make it as relatable as possible. So I talk about things like, if you are in a crowded elevator and you're going to work and you feel that you have to pass gas, your pelvic floor muscles must be able to contract and hold that in your body. Conversely, once you've made it to your car or to your office and you're alone and you're ready to release that, those muscles need to relax and open to allow yourself to do it. When it comes to lengthening, the bladder has to stretch and fill with urine. If our pelvic floor muscles were these rigid muscles and they couldn't lengthen, our bladders would never be able to fill with urine, our rectum would never be able to fill with stool, and our uterus certainly wouldn't be able to expand with the weight and size of a growing baby. And so those muscles have to have all of those components for those reasons. But yeah, kind of the first step for people is awareness of that area. People are totally disconnected to that area. Like you said, it's not a muscle group that you can really visually see the way you can see a bicep contraction. And so there are a couple different ways to get people aware of this area. You have your clients do a contraction and you ask them initially to do it. Some people can do it, some people can't, but just that kind of discussion of what that should look like and feel like through cueing can help people to accomplish it. You can also have people look at their perineum in the mirror and see those actions happening. And then they're like, oh, okay, yeah, I feel that. That's what it feels like to contract. Similar to stopping the flow of urine. Those kind of cues can help people to understand how to turn on those muscles. However, more often than not, especially after we have our babies, those muscles are actually too tight. They're guarded and they're tense. And so they don't have a problem contracting. They actually have a problem relaxing. It can be so counterintuitive for people because they're like, wait a second. You mean to tell me I just pushed a baby out of that area? You mean to tell me that those muscles aren't overstretched and completely relaxed and just have low tone? I'm like, correct. Exactly that. Those muscles are very protective in nature. They're kind of meant to guard and protect, especially our pelvic organs. And so when a baby comes out, due to the intensity of birth, those muscles are like, whoa, what just happened? And they tighten up and they guard. And that tightening and that guarding is even worse if there's suturing down there because you tore or had an episiotomy, or if you had something like a cesarean where there's now scar tissue in one of the pelvic organs, like the uterus. And so it's just super fascinating how pelvic floor dysfunction looks different for every single person, which is why there cannot be any cookie cutter styles of treatment with this work. So I can see two men who have, they're the same age, they have pretty much similar medical history, they have the same complaint of, let's say, pelvic pain. They could each be having it for a wildly different reason. And so with pelvic floor therapy, really finding a therapist who is going to do manual therapy with you, who is going to spend the time. That's why another main reason why I pulled out of the insurance model and why I pulled out of more corporate style therapy is because you don't have time to be with your clients. You've got 4 clients in the clinic at once, you're double, triple booked every hour. And these are private things. You need to go to private rooms. There is sometimes internal treatments to release these muscles. And so it's very difficult to have success in environments like that. And so it's so much nicer now to be able to spend the time I need to spend with people and have the privacy and the ability to do those things.
Now, one thing that you've brought up a couple different times, and I think it really builds on what you just said. One is just a lack of understanding about not only what the pelvic floor is, but what its functions are and what it should be doing for you. But then I also think a lot of guys don't understand that they have a pelvic floor as well. I think so often the pelvic floor is only spoken about in relation to women that, I was having a conversation with one of my male clients last month about this. You have a pelvic floor too. He's like, wait, what? Guys have a pelvic floor? So with that, do you find that a lot of guys don't understand that they have a pelvic floor? And so because of that, they don't even understand that this is something that they should be seeking out as well?
Yes. So I feel like in the realm of women's health, women's health issues don't often get taken seriously. There's not a lot of studies and funding that go into research for female pelvic issues, but men, truly, it's really not any better. There's a huge industry in terms of erectile dysfunction and Viagra. That's like a $50 billion industry, but I'm talking about male pelvic pain. These guys who suffer from male pelvic pain, they go to a slew of different doctors. They're put through the ringer. They're told it must be an STD. So they're put on chronic antibiotic treatments, even when they test negative for these things. And then their doctor's response is that it must be prostatitis or inflammation in the prostate. And they're like, okay, well, do my blood work. Do I have inflammation? What's going on? And everything checks out fine. And so literally they're left and told from their doctors that like, you're young and you're healthy and, you know, you're fine. All your blood work came back normal and you've been on a course of antibiotics. Like that's really all we can do for you. Never once do they mention go to a pelvic floor therapist, but that's a discussion for another day. But they end up finding their way into my office on their own, just by like researching, like something is wrong. I know it. And no one has been able to help me. And so I've learned a lot from them in terms of not only do they not know that they have a pelvic floor, right? And they don't even really know that that area exists, but they are very disconnected from their body in general. And so it's really been interesting and eye-opening to me to see that. And I don't know if that just comes from just like kind of that toxic masculinity of like, toughen up and like nothing's wrong and you're good or what, but there's a big disconnect with their bodies in general. And so it's really beautiful to be able to teach them about these areas and for them to be like, oh, of course, like, because men know muscles for the most part. And so they, once you talk to them in a language they can understand, they're like, oh, now I like don't even feel as ashamed about this area as I did and this problem as I did before. And I'm like totally bought in and like, let's go, like whatever you have to do. So the male pelvic floor, the way to access it for women, it's through the vaginal canal, and for men, it's through the rectum. And you would think that they'd be like, no, but once they understand the anatomy, they're like, whatever you need to do to get me feeling better. Like if that's how you access the muscles, like go for it. Like they're totally ready and willing to do anything to get better at that point. Men really, really benefit from pelvic floor health and education and just understanding what happens to the male pelvic floor over time. So as men age, their prostates are always sitting against the pelvic floor and kind of bouncing in their younger years, what feels like bouncing on a nice soft cloud. But as they age, their pelvic floors tend to get tighter and more guarded, and they lose range of motion and elasticity. So that prostate goes from bouncing on something so soft and cozy to bouncing on what feels like a concrete wall. And that's why there's so many men who have inflammation in their prostate, overactive, kind of oversized prostates, enlarged prostates, even prostate cancer numbers and PSA numbers are just going up and up and up. And this is becoming almost as prevalent as breast cancer at this point. And so what I have seen, I haven't done, I don't have like any desire to do research, but I wish someone would, because what I have seen is that when you work on the pelvic floor and release any restrictions kind of around the fascia around those pelvic organs, PSA numbers go down. And so it can be preventative in developing prostate cancer and just having better pelvic health, meaning better urination, better sexual health, all of that stuff, without having to go and take a pill like Viagra, you know? And so there's just better ways to let the body heal itself naturally versus just these quick fixes of like, well, it must be something, some kind of infection. We're just going to put you on antibiotics for 6 months. We don't care what that's going to do to your gut health, but like, this is the answer. So there's a lot of misconceptions about the pelvic floor out there for both men and women. I know when it comes to birth, the only thing, this is why I love putting on webinars and I love teaching about this topic, because nowhere in birth prep or childbirth education classes do you even hear about the pelvic floor, or if you do, you hear about doing Kegels and that your pelvic floor muscles have to be really, really strong to push out your baby. And that's not, that literally couldn't be farther from the truth. Those muscles need to be elastic and they need to open and get out of the way, because your uterus is actually the muscle that pushes out your baby, nothing else. So yeah, it's just lacking all over. There's misconceptions about it everywhere. But yeah, everyone truly at some point in their life would benefit from seeing a pelvic floor therapist and having an evaluation done.
I love that we're having this conversation, first of all. But one thing I love that you brought up is how once you explain things, people are like so on board. Like, even though this is a very, private area and it's affecting some very intimate aspects of people's lives. So I remember when we learned about in MAT about different muscles that, connect to the tailbone and connect to like the inner thigh area. We're all like, oh my gosh, it's so crazy. But, as soon as you become educated about the area, it becomes way less intrusive, or that, you're feeling like, oh, is this going to be appropriate for this to happen to me by this therapist? Because when you really are learning, and what we're learning from you is when you're learning about the function of this pelvic floor, it's like, hey, we're literally just trying to get this area to stay healthy, to maintain its health so that it can do the functions that it's supposed to do. So I'm so excited that we're talking about this. I hope that our listeners will gain that perspective as well. Just by talking about it, it makes it less weird or less scary or less intimidating to seek out help for this area.
Totally. There's a reason why they call prostate cancer the silent killer, because men will literally walk around with symptoms of it for a really long time and they don't say a word to anyone because that's taboo and it's weird. And my urine stream has changed. It's not quite as strong anymore, but I don't know, I'm getting old, or like I can't maintain an erection the way I used to, but I'm getting old, it's like, they kind of just don't feel comfortable talking about that area, especially any what they consider deficits in that area. But again, once like, oh, there are providers and practitioners who literally, this is their work. They specialize in treating this muscle group, no different than any other muscle group in the body, and maintaining the health of that area can be wildly beneficial for many avenues of your health and wellness. They're just like, oh, what a no-brainer. It's a no-brainer. So yeah, I love having these conversations. I could literally talk for days about these topics. I feel like exactly that. Like, people don't even know it exists still. We've made leaps and bounds in terms of like people being like, oh, I've kind of heard of pelvic floor therapy. I don't really know what it is, but it's not a foreign concept to me. So we've come a long way, but unfortunately there are still loads and loads of people who have never heard of this before.
I know a huge part of your focus is preparing women for birth and then also the postpartum period. Can you tell us a little bit about what kind of care are women receiving right now, and what kind of care are you trying to bring to the table?
I haven't even mentioned up until this point, I'm very non-traditional in terms of what you think of when you think of pelvic floor therapy. I specialize in something that's called visceral manipulation, which just means that I approach the body in terms of finding the source of dysfunction, which typically is in a higher level system. The muscles are usually a byproduct of whatever else is happening. The way I do my work is I find the area of greatest tension in the system, and I work very specifically there so that the pelvic floor can relax. So, for example, if we're talking about the hierarchy of our bodies, our arteries, our blood supply is like the queen of the system, the number one thing that reigns supreme, because if we don't have blood flow to our brain or to our heart, and that's a bad news. The thing below that is our nervous system. And then underneath that is our viscera, or our organs. So our uterus, our bladder, our rectum, the things that are the very things, right, that are involved in pelvic floor dysfunction. It's not just a problem of the muscles. So the muscles, bones, ligaments, and joints make up the bottom, lowest of low on this totem pole or system of hierarchy. So those structures kind of become similar to like pawns in a chess game where they will sacrifice themselves for the good of the king and the queen, right? So when you have pelvic floor muscle tightness, right, let's say overactivity, too much tightness, creating pelvic pain or leaking or whatever the case may be, if we just hone in on those muscles and let's say do internal release techniques, stretching and things like that, your muscles will release with manual therapy. However, by the time you get to your car in the parking lot, those muscles are going to tighten and guard again, because there's this feedback loop happening in our bodies at all times where the muscles are like, but wait a second, there's still restrictions around the bladder or the uterus. And so we have to guard and we have to protect. So this is why for cesarean mamas, for example, cesarean mothers actually have a higher incidence of pelvic floor dysfunction and pain with sex, even though a baby did not come out of their vaginal canal, than a woman who has a vaginal birth for that exact reason. Because your pelvic floor muscles are more likely to be tight, guarded, chronically shortened in order to protect the restrictions around the uterus. And so until you have manual therapy for the source of the problem, which is the restrictions around the uterus from your scar tissue, those muscles will stay in this tight pattern no matter how many times you stretch them, release them. And so I actually see a lot of people in the clinic who are like, I tried physical therapy, pelvic therapy. I did like 3 times a week for like 12 weeks, which as a new mother, like who can even do that? Like that doesn't, you know what I mean? Like that's like crazy to me. I'm like, whoa, like that is a lot. But where they come in and they're like, I'm not better. Like, I don't even know, like maybe I'm not leaking quite as much, but I still have all of the same symptoms that I had when I started. So it's very different, I guess I would say, than any kind of traditional physical therapy. I don't do a whole lot of exercises and stretches. I will give you certain things here and there if I really feel it will be beneficial, but I'm predominantly a manual therapist. So in my treatment sessions with clients, a lot of the work is on fascia in the abdomen, fascia around the pelvic organs, wherever you are holding your restrictions, which are, again, unique to each individual. But if you think about things like urinary leakage, a traditional pelvic floor therapist would be like, oh, her pelvic floor muscles are weak. Like they can't hold her urine in. So we need to strengthen. Same thing for pelvic organ prolapse. Oh, her organs are falling out of her body. We need to strengthen in order to hold those things in. That's not what's happening. So those muscles are actually tight and they're actually trying to guard for those organs that are falling out, or, the organs that are in dysfunction, like the bladder for leaking. And if we strengthen those muscles when they're already overactive, you're now just constricting a chronically tight muscle. You now lose the inability to lengthen it and relax even more than you already had before. Kind of the way that you would think those things would be treated is actually the opposite of how I approach them and how I treat them. So with something like urinary leakage or pelvic organ prolapse, again, those muscles are tight and guarded. They're trying to protect that area. So if we just address the muscles and we never work on the actual bladder or urinary tract itself, which goes all the way up to the kidneys, people will get better, but not better. You know what I mean? Like they maybe will notice like a little less leaking or a little less heaviness, but they don't actually heal from these things and get them to go away where they can move on with their life. So it's a really different form of therapy. It's the standard of care. It's done routinely in Europe. And so I've done extensive training in it to learn how to do it, but it's really fascinating work.
Well, Dr. Stefanie, that is fascinating. Thank you so much for sharing all that with us. Where can people learn more about you, connect with you if they are in the Chicagoland area, and how can people schedule with you?
Yeah, you can follow me on Instagram. It's at Dr. Stefanie. I'm always dropping some information and gems and little educational things on there. And then there's also my website where you can hop on there, schedule an appointment right from the website, or even just a free consult call. So I offer those again for people who are like, I do have some of these symptoms, but I just don't really know what this process is going to look like, or if she can even help, or if I'm a good candidate. And so I hop on free consult calls with people all the time to explain these things to them and to say, oh yeah, for sure. I see this every day in the clinic, because you always feel like you're the only one going through it and like no one else is experiencing it. And that's really not the case. I do free consult calls with people, but they can schedule right from my website or from the number that's on my Instagram or on my website.
That's awesome. And then do you have a network of other pelvic floor therapists like throughout the U.S. where if somebody is located in a different state or whatnot, that they could connect with you and then you could refer them?
Yep. I have people who contact me all the time for like a virtual wellness session. And part of that is, like, let me look at this provider directory and let me see if I can find you someone who has these qualifications, who can see you out in your area. So yeah, I definitely have provider networks and all kinds of things for people who are virtual out of state. So I can help them as well.
That's perfect.
Great. And I will attest to Dr. Stefanie has an awesome Instagram page. I love following her. She's always giving like good info and tips and I think you do regular webinars too.
Yeah, I just started to make that more of a regular thing because, again, it's just exposing people to the fact that this world exists and that there is help. It can be very isolating and very hopeless when you feel like you're the only one or you've been to multiple doctors and no one's been able to help you. So I like to get this knowledge out there and I love to teach. So webinars are one easy way I can kind of teach and reach other people.
You bet. You bet. Now, the question that we like wrapping up with for all of our guests is, Dr. Stefanie, what is your definition of health?
Ooh, that's such a good one. Oh my goodness. I think my definition of health and wellness is being able to do the things that bring you joy. So what I tell all of my people who see me, we talk a lot about goals, and I'm not selling physical therapy, right? I am helping someone to get their life back. Meaning, if being able to be intimate with your partner is the one thing you want to be able to do and you haven't been able to since the birth of your child due to pain, that's what we're focusing on. And so that's really what I'm selling, is whatever matters to you and whatever makes you feel like you've achieved health and wellness and reached kind of what you're trying to reach. So it's individualized, but yeah, I think keeping people's goals at the forefront is the most important thing.
That's awesome. That totally vibes with everything that we talk about on this
Yes,
podcast. And with our
awesome. I
clients.
love it.
Yeah, for sure. Well, Dr. Stefanie, thank you so much for sharing your time, your expertise, your stories with us. It really is a fascinating topic, and it's something that is not widely spoken about and is commonly misunderstood. So thank you for shedding light on everything about the pelvic floor and just how important it is, how crucial it is that people strongly consider, like, hey, there might be something going on with my pelvic floor and I need to seek out some help with this.
Yes, absolutely. Thank you guys so much for having me.
You bet. Hey there, it's Charlie again. One last thing. I want to let you in on a secret project that I've been working on for quite some time now. I am planning on releasing a book by the middle of summer 2021. But here's the thing, because I'm self-publishing this book, there's only going to be a limited number of copies available at any given time. So to learn more about this book and to be one of the first to find out when this book actually gets released, what I need you to do is go to exerciseforlifemethod.com. There you'll find out more information as well as some exclusive bonuses that I'm offering just for simply staying in the loop with what's going on with this book. So to learn more and claim your bonuses, go to exerciseforlifemethod.com, enter in your information, and you'll be automatically kept up to date. Learn all about the book and bonuses at exerciseforlifemethod.com. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Julie and Charlie Gates, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical issue, consult a licensed physician.